This is the Loc TLSO. Loc stands for thoracolumbar orthotic control, used post-operatively for more support, usually the torso, upper torso, thoracic area, or post-operatively from a pretty major surgical procedure. So this is very rigid plastic. It's called modified polyethylene. It's been vacuum formed, it's been molded over some molds. It's very rigid and supportive. So this is like the old clamshells that we used to use in the old days. What we have is a back panel, straps, and a front panel. For a female, I open up the front. It's more comfortable to wear. And again, it's in different sizes, tall for a taller patient and shorter for a shorter patient. She's got an average height here. So what I like to do is put it on her prior to surgery and then show it how it would be used after surgery. So what we'll do is we'll stand up. I'll have you hold this right in front, right around her chest, right in the middle. I'm going to take the back side and I'm going to let you turn right around for me, and I'm going to center her to the small of her back, and I'll show you just what it looks like. What I'd like to do is take one side first. Usually what patients will do is they will anchor their body against something so they can do this easily. It's a lot harder when you're standing up. Okay, so let's take that and turn around for me so they can see what we just did. We take the front strap and the front panel and go over the back panel. That's important so that you can actually get the brace to cinch tighter. We take the bottom thread, loop, and thread it through, and we just sort of pull it tight. Okay, does that feel snug?
Yes.
All right, now we do the same thing to both sides. Let me re-anchor this one. Okay. Taking this one, we go up and grab it on the side, come through, and we'll pull it through carefully, and then we come down. What you want to do is pull gently on the upper part of your torso, pull forward. There you go, and tighten it. Good. All right. Now remember, you just had surgery, so you're not going to be able to move much. So what we're trying to do is mimic what your body would like to feel like, and that's supported. All right, you can let go. This is what it looks like from the front. It's almost like a molded TLSO brace, but this is made off the shelf. We make it off the molds that match her anatomy. I would normally have this a little bit more for her anatomy. This is a 50-degree mold. We probably need about 20, 25 on her, so it can be touching it all the time. But for purpose of just demoing it, you can see what it looks like, and we could obviously do that at the shop. The back should be about to the top of the thoracic area, if you'll turn around. That's fairly comfortable, and along the bottom of the back, the small of the back, obviously, where it needs to be. And then the patient can sit down, if you will, Tracy. See how it stayed with her? You watch the crease right at this angle here is where you watch where you sit, so the hips don't push and the legs don't push it up. You want to make sure that that little area stays right in the small of where her legs are, so she can sit even in a couch or something that's softer. This is the way the brace should be worn, and this is the way it should fit. Normally you will wear this for usually 3 months minimum, sometimes a little longer. It's up to your doctor's protocol. What we're looking for is an optimum fit, something that fits well, comfortably, and it almost looks like it's made from a cast, which is actually it's different sizes are made from cast. We've taken the best of both worlds and come up with about 80% of the patients that we can fit with these braces. Now I'm going to show you how it would be done in a hospital setting. To apply the brace, what you want to do is take the back panel. While the patient is supine, we're going to decide which way to roll. In this case, we're going to log roll to the left, keeping the spine straight. So we're going to bend the right leg, take the right arm to the bed rail, and she's going to roll on one side, keep going, all the way. Sometimes you'll have help. You're going to take the brace at the crest, in her crest, and you want to come underneath and scoop it. So it's centered in the center of the spine. We bring these back to the other side, then she'll log roll back. You can come on back, JC. Making sure the brace doesn't shift. And then she's back into the middle. With the patient supine in the proper alignment, we will now position the top piece over the back piece, making sure it's like a clamshell. You want to take the outside, go over the back. So you'll come around and around. JC, if you'll hold at the top, nice and firm, what I'll do is take this, slide it through the bottom ring, push gently on the tummy, and pull. Do the same thing with the opposite side at the bottom first, so that you're equal in alignment. Obviously, you might have help for the nurse too. They'll do it at the same time, so both of you are doing it at the same time. Once you do the bottom, you come to the top, pull it through, go ahead and pull tight, there you go. Good. And this is the way you would put it at the hospital, obviously. Either the patient did have surgery or they're still in with a broken back and maybe will not have surgery. It could be used at a burst fracture. What you'll do then is let the doctor decide once they've had their x-ray in the brace. To get up out of bed, she will log roll properly by not bending your spine. Bend your arm, push up, come down with your legs. And normally you'll have help at the hospital in a rail. Careful not to bend your spine. Good. Good job. Obviously you have to kind of get up, kind of clear your head a little bit, sit up, and then you come off the edge of the bed, touching down, and then making the adjustment for the brace once you're up. So that you see that it stayed pretty much in proper position. But if she needs to, just take your hands and pull it down and readjust it, and then she can walk forward. So you can do your therapy. This is normally worn to get out of bed and walk after surgery. First time up, she just got up for the first time, and that fits really good. That's what we want it to look like. If there's any other problems with it, you need to let us know, or the physician or the professional that fit the brace for you. This is the Loc TLSO by Optimum brace. Thank you.